Hi, this is Shane with ADL. I'm going to give you an overview of 10-Minute Balance. 10-Minute Balance is our exercise program to help improve balance at home. And we use it in the clinic for our home exercises as well as for the exercises that our patients are going to continue to do after they finish in therapy. In Steady for Life, our fall prevention program, it also serves in that same capacity. It's going to be the foundation of exercises that patients will do throughout that program. It'll be what they're doing at home and practicing in between sessions when they're coming in to see you. And it's also what we're coaching them up and gearing them up towards where they can continue on to carry on with these exercises after they finish that fall prevention program, Steady for Life. So let's take a look at what it is. There's two formats. You'll have a digital, which is on Steady for Life, or maybe you've downloaded that, or you have the booklet. And the booklet and the digital are exactly the same thing. The majority of what's in this booklet is going to be an explanation of the exercises. So I just randomly turned to to exercise 14, but it'll give a picture as well as a description. At the front of the book, the first probably really important point is talking with patients about safe setups to practice balance exercises at home. So we need to have them in a safe situation so they have something secure and steady nearby. We also want to visit with them about not waiting too long to seek to reset their base. If they start to lose their balance, go ahead and hold on, touch on to things quickly rather than waiting too long and really having a large stumble or a problem there. And then the last part is not overestimating their abilities. We want to make sure that they're choosing exercises, or we're helping them choose exercises that are going to be appropriate for them. So as we get to the exercise selection component, you're going to see the balance exercise tracking sheet, and that'll give us a chance to note in the column here which exercises we want them to perform. So I'll show you on the screen. I kind of looked at those on the hard copy, but let's take a look at them in the computer here. So you'll see right here is where we're looking at the different setups. So we show options of being in front of a table, being near a sink, or being in a corner with a wall, or using some of these other setups when they're doing gait exercises. Basically, they want to have something secure on both sides. So then we were just talking about that balance tracking sheet, and this gives the recommended column where we'll note in that column, and I'll show a picture of a patient that has one filled out. I just posted one to 10-Minute Balance Facebook group, so I'll pull that into this video too. But that way we'll select different exercises that we think are appropriate for them. And then the goal on the patient side is they're going to choose 10 minutes of these exercises each day. And if we've selected more than 10 minutes worth in that recommended column, then they're just going to select only 10 minutes amongst that group. If we haven't checked it in the recommended column, then they're not going to perform those exercises. So there's 24 possible exercises. Maybe at the end, we may have checked 17 or 18 of those exercises. So there might be 5 or 6 that just aren't going to be appropriate for this particular patient. But the idea for 10-Minute Balance is we want to have a fairly robust program so that way we can use it for folks that are just getting started on their balance journey, as well as other individuals that have a higher level of balance. We'll still find a way to challenge them in this program. So let's just take a quick look at one of the exercises, and we'll look at just the first one, which is a 1-minute exercise. I kind of breezed past that, but we have 1- and 2-minute exercises. 12 of the exercises last for 1 minute in duration. The other 12 last for 2 minutes. The main difference with the 2-minute exercises, it'll be a minute with the left foot forward and then a minute with the right foot forward. So as you look at those, it'll kind of break down and make more sense that way. But just looking at exercise 1, standard stance, we're just standing with our feet normal width apart and trying to find balance there without touching or holding anything. So that will be easy for a lot of people, but some people it'll be hard. If we want to add additional challenges for the folks that it's easy for, we'll bring in things like the home foam. So that'll give them a soft surface to stand on, which will make it a little bit more challenging. We might add reaches, we add head turns or head tilts. If you're confident and they're confident standing with their eyes closed, we could add that in as well. Just make sure you always check on these additional challenges with your patients before you give them to do at home. You'll also see the balance T in a lot of the exercises. The T just makes it easier to explain exercises. It's also helpful to help guide motions and movements, in particular when you start getting to the stepping exercises. And we'll have hurdle stands that we can set that T on. As those patients get better and better, we can raise that T off the ground. So I invite you to go ahead and just kind of peruse through the different exercises in this 10-minute balance program. Get familiar with them so when you want to bring those in for your patients, you have just a thorough understanding of what these exercises are. So that really kind of gets you oriented to 10-minute balance. The main part is we're going to select the exercises. The patient's job is to practice balance 10 minutes a day, every single day, trying to build consistency with that performance so we can get the best results for their balance, get them steady on their feet, and back to enjoying life. So thanks for tuning in. Hit me up with any questions you have at shane@adlbalance.com. Be happy to hear from you. And as always, we'll see you again in future videos.